How to manage thyroid-related voice changes. Have you noticed changes in your voice and wondered if it could be linked to your thyroid? Thyroid-related voice changes can occur due to thyroid dysfunction or as a result of thyroid surgery. To effectively manage these changes, it is essential to address the underlying thyroid disorder, protect your vocal health, and consider specific voice therapies when needed. First, treating the underlying thyroid disorder is crucial. If you have hypothyroidism, your doctor may prescribe thyroid hormone replacement therapy, such as levothyroxine. For those with hyperthyroidism, antithyroid medications can help. Once your thyroid hormone levels stabilize, which usually takes about 3 to 6 months, you may notice improvements in your voice quality. Regular monitoring of your thyroid function tests is important. This helps ensure that your medication doses are adjusted correctly to maintain normal thyroid hormone levels, which supports vocal cord function and reduces voice symptoms. Next, protecting your vocal health is vital. Staying well hydrated helps keep your vocal cords lubricated. It is also important to avoid behaviors that can strain your voice, like excessive throat clearing, yelling, or speaking loudly for long periods. Practicing good breathing techniques, such as diaphragmatic breathing, can support your voice production. If you experience hoarseness or fatigue, make sure to rest your voice. Additionally, limit the use of medications that can dry out your vocal cords, like some over-the-counter cold and allergy drugs. Avoid smoking and exposure to secondhand smoke, as these can irritate your vocal cords and worsen voice problems. If you have experienced voice changes after thyroid surgery, early referral to a speech-language pathologist for voice therapy can significantly improve your voice quality and function. Voice therapy can help with issues like vocal cord weakness, breathiness, and strain. In cases where vocal fold paralysis occurs due to nerve injury during surgery, surgical techniques to preserve nerves are essential. If nerve injury happens, procedures like nerve reinnervation may improve your voice outcomes. Preoperative and postoperative care is also important. Educating patients about potential voice changes before surgery helps set realistic expectations. Surgeons often use nerve monitoring and careful techniques to minimize nerve damage. After surgery, monitoring for hoarseness or voice changes is key, and timely referrals for voice therapy can make a difference. If you notice any new or persistent voice changes, such as hoarseness, breathiness, or vocal fatigue, it is important to seek medical evaluation. Thyroid function tests can help determine if these changes are related to hormone imbalances. A laryngoscopy may be necessary to assess vocal cord function, especially after surgery or if nerve injury is suspected. In summary, managing thyroid-related voice changes involves a combination of medical treatment to normalize thyroid hormone levels, vocal hygiene practices to protect your voice, and specialized voice therapy when indicated. Collaboration between endocrinologists, surgeons, and speech-language pathologists can optimize voice outcomes for those with thyroid disorders. Always consult with a healthcare professional for personalized advice and treatment options.